Now, what's happened here in Flint has produced a tidal wave of changes in the approach to dealing with lead exposure, not just in Flint, but all over the state of Michigan.
Yeah, we've got Dr. Frank McGeorge here right now with the important medical developments that are bringing improvements, not just here to Flint, but every community.
Right. Well, that's exactly it, Devin. And Kimberly, you know, anybody that was involved in the Flint water crisis acknowledges this was an avoidable tragedy of epic nature, but the ripples caused by the water in Flint, well, they haven't all been bad. We've learned important lessons that may help generations to come.
There's so many amazing things happening in Flint right now that weren't there a year ago or 2 years ago.
Dr. Hanna-Attisha would know as the foremost medical advocate for solving the lead crisis.
We have investments in education. We have universal 4-year preschool in Flint. We have a new child care center that opened for 0 to 5. We have school health nurses. We have a mobile grocery store that is roaming the streets of Flint delivering fresh fruits and vegetables to Flint residents.
These are some of the remarkable changes that have been made in a direct effort to limit any injury caused by lead exposure. But here's the bigger question, one that reaches into every part of the state.
What do our vulnerable children in Flint and our vulnerable children in Detroit and all these other communities where we have kids with disparities, what do they need?
To help answer that, a state lead commission headed by Lieutenant Governor Calley has been meeting regularly in Lansing. Dr. Eden Wells is the chief medical executive for the Michigan Department of Health and Human Services and sits on that commission.
But all of the same things we're doing for the children in Flint are great for any child in Michigan. There's been quite a few improvements, I think, in how public health is addressing lead, not just in Flint, but across the state.
One major change is a more proactive approach to the problem of lead. Instead of finding out that a child has been exposed by checking them after the fact,
we'd really rather look and eliminate lead from the environment.
That means looking for it.
As we go about this, I think we have to understand in our environments, lead paint remains probably the #1 source.
Lead paint is especially a problem in homes built before 1978, often found in cities like Detroit.
There is some great work coming out of Wayne State here in Detroit, and with the city health department here in Detroit have been great leaders.
Within the city, generations of children have turned up with high lead levels, generations of children who lived in the same home.
So how do we stop that? We say, well, that's not a problem of the family raising their child. That's a problem of that home from which all these different families lived in. If we can abate that property, and there's some beautiful homes here in Detroit, let's do it. But really what we're going to be asking for is there really should be an effort to actually eradicate or get rid of any of that old lead paint before there's a change in ownership of a home.
Beyond even the risk that lead paint poses, there's an increased awareness of every source of lead.
It's in paint, it's in soil, it's in dust, it's in imported toys, it's in some, different kinds of makeups and different things. So there's lead in many other sources.
And of course, there's the water.
Before the Flint Water Crisis, it was not well known the role that water could have in delivering contaminants to a person who uses municipal water, or any water for that matter. We understand now that lead can be actually mobilized even if you're having work done in your front yard and you're not living in Flint where there was corrosive water. So all of these things we're learning, we are going to be able to develop increased processes or enhanced processes to eliminate lead from the environment so the child's not exposed.
Sometimes you almost need a tragedy to bring people together, and there's people who are working together that never used to work together, but they see a future for Flint.
So I hope to see that Michigan remains in the forefront.
And so now as they're made, the Lead Commission recommendations are being reviewed by local agencies and health departments, the governor, and the legislature to hopefully lead to meaningful change in the future.
Anybody that misses the broader lesson here, that we have aging infrastructure all over America.
Yeah.
This was the canary, so to speak, in the coal mine, but the lessons that are being learned here will hopefully mitigate these problems elsewhere.
That's exactly right. Tip of the iceberg, lessons learned here can be applied across America. It's really a great opportunity, just unfortunate circumstances.
Okay, we'll check back in with you a little bit later in the broadcast, Doc. Thank you.